You're watching Stories by SC. This is where global headlines become human stories. Where we don't just follow the news, we trace its shadow. Subscribe to join a community that digs deeper, questions more, and seeks truth in a world of noise. Tonight's story is one the world is already talking about but few truly understand. May 2025. In a quiet meeting room at the World Health Organization's headquarters in Geneva, a global agreement was finalized. It didn't make front-page headlines. There were no dramatic press conferences. No dramatic music. But behind the calm was a storm. The WHO pandemic treaty had finally been signed. After 4 years of negotiation, the world had put pen to paper on a document that, according to some, could change how we respond to the next pandemic. According to others, it's the start of something far more concerning. Part 1. The pandemic that shook the world. To understand this treaty, we have to return to the global trauma that inspired it. The year was 2020. A virus, once confined to whispers in Wuhan, rippled across the planet. Governments panicked. Hospitals overflowed. Economies crumbled. But perhaps the greatest failure wasn't medical, it was political. Nations closed borders. Refused to share information. Fought over vaccine supplies. The concept of global unity dissolved almost overnight. The COVID-19 pandemic exposed just how unprepared we were, not just medically but diplomatically. When the dust began to settle, one question echoed through the corridors of power: what if we could prevent this from ever happening again? Part 2. The birth of a treaty. The answer to that question took shape in late 2021. The World Health Assembly, governed by the WHO, proposed the creation of an international pandemic treaty. Not just guidelines, but a binding agreement. A promise that the next time humanity faced a health emergency, it would do so together. But creating a treaty like this was anything but easy. Between 2022 and 2025, diplomats from nearly 200 countries met again and again. Some nations wanted stronger powers for the WHO. Others feared losing control over their public health systems. Questions of sovereignty, transparency, and enforcement dominated the conversation. And yet, against all odds, an agreement was reached. Part 3. What's in the WHO Pandemic Treaty? So, what exactly does the treaty say? It's built around several key pillars. Equitable access to vaccines, diagnostics, and treatments. Transparent and rapid data sharing between countries. Mandatory national pandemic preparedness plans. Support for lower-income nations in public health infrastructure. An independent monitoring body to assess compliance. In short, it aims to ensure that no country is left behind and no outbreak is allowed to spiral into another global disaster. But while the treaty looks good on paper, reality is often messy. Part 4. Praise and Promises. Many experts call the treaty a historic achievement. They point to the failures of 2020 and say this is a vital course correction. A chance to build trust between nations and act faster when new threats emerge. Leaders from the global south have especially championed the treaty, calling it a step toward fairness after years of being sidelined during crises like COVID. But praise isn't universal. Part 5. Controversy and Conspiracy. In some corners of the internet and in several national parliaments, the treaty has ignited outrage. Some say it gives the WHO too much control. Others claim it's the foundation for a future global health dictatorship. Viral videos accuse the WHO of plotting to force vaccines, impose digital health passes, or even override constitutions. These claims are largely misinformation, but they tap into real fears. In a post-COVID world, people are more suspicious of global governance than ever before. The treaty's defenders argue that these concerns are overblown, that the WHO can only recommend, not enforce, that national laws still reign supreme. But in the fog of mistrust, truth often struggles to shine through. Part 6. A treaty without teeth. Even supporters of the treaty raise a critical question. What happens if a country doesn't follow it? The truth is, not much. There are no binding penalties. No international court that will force compliance. It's a treaty built on cooperation, not coercion. That makes it flexible, but also fragile. If global trust breaks down, if countries start hiding outbreaks or hoarding supplies again, this treaty could become another broken promise. Part 7. Who really benefits? Here's where things get more nuanced. The treaty could benefit poorer nations by ensuring better access to life-saving tools. But wealthier nations still control the funding, the research, and the patents. Critics warn that without deeper reforms in how global health is financed and governed, the treaty could just become symbolic. A shiny document with noble words, while power and resources stay locked in the same hands. Part 8. The next outbreak. A question we've all quietly asked ourselves. What happens when the next pandemic strikes? Will this treaty make a difference? Will leaders pick up the phone and share data? Or retreat behind closed borders again? Will vaccines be distributed fairly? Or will the rich race ahead? No one knows for sure, but history suggests that when fear rises, so do barriers. Conclusion. The WHO Pandemic Treaty is not a magic bullet. It is a test of global trust, a test of political will, a test of whether we've truly learned anything from COVID-19. Whether it unites us or divides us will depend not just on world leaders, but on all of us, on how we think, how we vote, and how we talk about the future. The treaty is signed. The ink is dry. But the real story is just beginning. You've been watching Stories by SC. If this episode made you think, or made you question, then we've done our job. Hit subscribe. Share your thoughts in the comments. And remember, the world doesn't change with headlines. It changes with stories. See you in the next one. Subscribe for more. Dive deeper. Stay aware.